Good evening, I'm Anthony Mason, and by the time this broadcast is over, 3 people will be dead. Victims of an opioid epidemic that's taking 140 lives in America every day. Opioids are responsible for the overwhelming majority of drug deaths, which these maps show have grown dramatically, from just under 17,000 in 1999 to 52,000 in 2015, a more than 200% increase. Today, President Trump declared a public health emergency to fight the epidemic, but critics were quick to say that does not provide the money to get the job done. Here's Major Garrett.
We owe it to our children and to our country to do everything in our power to address this national shame and this human tragedy.
President Trump stopped short of declaring the opioid crisis a national emergency, opting instead for a public health emergency declaration. It will streamline some access to addiction treatment, but provides few new resources. Financing comes from the Public Health Emergency Fund, which has a balance of just over $56,000. The federal government estimates the crisis costs $75 billion annually. Nearly 12 million people misused opioids last year.
And I'm saying officially right now, it is an emergency. It's a national emergency.
In August and again this month, the president said he would declare a national opioid emergency, which would have provided access to billions in federal funds.
Without any additional resource allocation, I think it really doesn't make a difference what we call it.
Michael Botticelli, drug czar under President Obama, said today's announcement did not go far enough.
It's largely rhetoric and very shallow in terms of really taking major actions against the epidemic.
In his speech, Mr. Trump talked about addiction in personal terms. He cited his brother Fred, who died at 43 of alcoholism.
And he would tell me, don't drink, don't drink. He was substantially older, and I listened to him.
It's shifting the way that our society thinks about this disease.
Gary Mendel's son Brian committed suicide after years of struggling with addiction.
What he spoke about today is a great first step in reducing the shame and stigma that goes along with this disease. But I want to emphasize first step. It's not one speech or one remark.
The president lacks key leaders on the opioid front. He is yet to name new nominees as Health and Human Services Secretary, drug czar, or administrator of the Drug Enforcement Agency. Anthony?
Major Garrett at the White House, thanks.